To finish up our morning session prior to the Q&A is from Dr. Rahul Pannala. He is an associate professor of GI hepatology at Mayo Clinic. He did his residency training at Bridgeport, Yale in Connecticut, followed by fellowship in GI and hepatology at Mayo Clinic, Rochester. And thereafter, he completed additional fellowship training in therapeutic endoscopy in Seattle. His area of expertise is in bariatric endoscopy and hepatobiliary disease. Thanks, Dr. Pannala.
Good morning, everyone, and thank you to Dr. Moats and Dr. Jain for the kind invitation. And it's very apropos that the last talk before lunch is on obesity, but I'll try to make this interesting and sort of paint a picture of what's coming down the pike and how, it's kind of unusual for a gastroenterologist to get up and talk about obesity, but what we can contribute to you as primary care physicians who are taking care of these patients. Those are my disclosures, research support from one of the companies, but I'll present a broad spectrum of information. So this is the outline of my talk. I'd sort of go over the scope of the problem, which you already know, talk about treatment options, specifically focusing on all the available endoscopic bariatric therapies and what you may see over the next few years. And we'll talk about, try to put something together at the end. So this map is very stark and very well known to most of you. There is no state in the United States which has a less than 20% prevalence of obesity. And that's really, tells a lot. So this is a problem that we all see every day in the clinic and that we recognize, but we have really very limited options to take care of. Now this, more than me, as primary care physicians, obesity is associated with many diseases. At the last count, there were more than 180 diseases that are associated with obesity. And these are diseases that you take care of every day in your clinic: type 2 diabetes, inflammation, malignancy, hypertension, cardiovascular diseases, and so on and so forth. So I think the point is that our patients, the vast majority of patients suffer from this chronic disease, and we need to offer new options. So the treatments for obesity, the cornerstone of treatment is comprehensive lifestyle modification. What does comprehensive lifestyle modification mean? It's lifestyle behavior training, dietary change in terms of decreased energy intake, decreased calories,